So setting up my Facebook one. Jeez. Good morning, everyone. It's Szenan from Self-Diagnose, the acupuncturist. It's 7:13 New Zealand time. Good morning. Hi, Veronica. How are you? Good morning. Good morning. Hi, Happy Day. How are you? Good morning. Good morning. Thank you for being here with me. It's Szenan from Self-Diagnose, the acupuncturist. Right. Today our topic is lower back causes. So what are the causes of lower back pain? The lower back pain causes. This is our topic today. So good morning. A happy day. Good morning. Seems like my clinic, okay, YouTube's ready now. Good morning, everyone. So another topic today, another subjects, lower back pain causes. Now, every day, every morning, I'm going to do one little topic at a time. Okay, like in this week we talk about talking about lower back pain. Yesterday we talked about lower back pain symptoms. The day before we talk about what is lower back pain, and today we talk about lower back pain causes. Then further on we're going to talk about treatments, and for the treatments we're going to talk about what do they do in Western medicine, what they do in Eastern medicines, both different medicines. What do we do? Then home remedy. What can you do for yourself? You suffer from back pain. Acupressure point. That's something that we need to introduce there. Now, for acupuncturists, you can learn acupuncture point strategy when we come to lower back pain treatment. Now, then we're going to talk about prevention. How could you prevent lower back pain? Now, so today is important. If you don't know about the causes of lower back pain, then how could you prevent it? So that's why we're going to talk about lower back pain causes today. And that's important. That's very important. Now, if you are here now, please say hello to me. Yeah, that's me. That's me. Oh, turn on the heater again. It was on before. Now, okay. If you're on this live video, please give me a thumbs up and say hello to me. And please tag your friend. If you're on Facebook, tag your friend into this live video. All right, thank you. Then it's feeling cold in here. It's in my office. It's winter in here, so early morning in here, and I turn on the heater already, but obviously it hasn't warmed up yet, so I have to turn it off. If I turn the heater fan up, it's gonna make a lot of noise, so you won't hear me properly. Let me clear my nose. Hi Hassan, how are you? Happy day. Monica, good morning. I'm very good, thank you. I have to have a jumper to keep me warm, right? Thank you. No, I'm pretty good, thank you. So we're running nose in the morning, it's a bit cold. Okay, that's it. No big deal. Got hot one here. Once I warm up, it's fine. Okay. Now, thank you um, for asking. Okay. Um, Now, yeah, the last step is share this live video. If you're on Instagram and Facebook, please share this. Now, if you watch the replay on Facebook and YouTube, you can fast forward. You can fast forward. Remember that you can fast forward. But normally we take about half an hour to talk about the topic daily. Okay, so thank you for being here with me and join me in this live video. Thank you very much. Right, the most common cause of lower back pain are strain and problem with lower back structure. The structure we talk about it in the first time, in the first day. Uh, what is the structure here? Vertebrae, disc, right, and muscle, tendon around the vertebrae. Okay, so these are all we call structures, and it'll compress the nerve, the yellow one. That's the nerve. That's why it's causing pain, right? Now, okay, the very common one is strain. What strain? Strained muscles, right? Often cause back pain. Very often, the most common one is the strained muscles. So, um, what do you do that causing the muscle pain? Lifting. Lifting a heavy objects or certain awkward movements. So what is certain awkward movement? So stand up, just like standing up. It's very quick. Okay. And I have patients who have mm, been in the toilet and just get up from the toilet. Finishing, get up from the toilet and go back pain. Strain the back pain. So that's because a lot of movements as we getting older, as we age, this thing it won't happen in little kids. You know, it won't happen in little kids. Why is that? Why is that? Because they're younger. That's right. Because their circulation is better. That's right. You know, and because the stomach and spleen function are better, according to Chinese medicine. Why is that? Because when stomach and spleen function better, the muscles are stronger. So muscle weakness causing from stomach and spleen function, according to Chinese medicine. So I'm telling you this is not based on Western medicine's theory, it's on Chinese medicine theory. And the Chinese medicine theory, we talk about the organs control the entire body. So all the structure controlled by the organs. Stomach and spleen control muscles. Liver and gallbladder control joints and tendons, as well as nerve functioning. Then kidney and bladder control what? Control bone. Now we know. Let's have a look in here. joint, right? Joint, vertebrae is joint. Who control it? Liver and gallbladder. Then nerve, liver and gallbladder. Vertebrae is bone structure, kidney and bladder. And the muscle around it, that is stomach and spleen. So it's important to know this. A back pain that can cause the from the imbalance of the organs. Therefore, as a Chinese medicine practitioner, an acupuncturist, when we treat patients, we ask those organs questions. We need to find out whether your bowel motion are normal or not, your sleeping are normal or not, your eating are good or not, do you have any tummy pain, bloating, all these things. Why did we ask all those questions? I always have to explain to my patient the reason we ask this question. It seems that it doesn't link to your back pain, right? I have a back pain. Why do you ask me about my appetite and my sleeping and whether what my bowel motion look like? Because they are related. The patient didn't know that, but they didn't understand it because the Western doctor, no one told them that the bowel motion, loose, or constipation will affect the lower back. And the simple things that I explain to my patient, I said, well, if you don't go to the toilet for 3 or 4 days, you get more pressure on your tummy, and the pressure build up, it compress to the nerve or to the muscle. That's why you get low back pain. That's one of the reasons. So oh yeah, that makes sense. Something like that. So just make some sense for my patient. I'll explain further sometimes. Okay, this is when we see patient is a Chinese medicine practitioner, herbalist, and acupuncturist. We need to go through everything, right? So in our clinic, we get patient to fill in all the question, organs question. We ask all the question and get patient to tick whether they have those symptoms or not. They have to take it one by one, one by one, one by one. Okay, they have to take it. Do they have those symptoms? We ask them about the first main complaint, second main complaint, third main complaint, and they can put down what they're coming here for. If they put back pain, the second one neck pain, the third one's knee pain, or the third one is actually diarrhea, then we know, hey, this diarrhea connect to the two of them, the pain, right? We always, and then further on, they have to fill in the organs question on the heart. What, you sleeping well? Can you, when you wake up, do you feel energized? Things like that. And ask about the emotional. So each organ have the emotional energy connect to. All right. So all the bunch of symptoms from the organs are very important to any disease, including the cause of lower back today. Not until you get, to be honest, you can get relief from many different treatments, chiropractor, osteopath, physiotherapy, and acupuncturist, massage therapies, or painkiller. So what made us acupuncturists and Chinese medicine herbalists different? The difference that it made us from the others is because we realize we have the version, or we have the theory of the organs function connect to the entire body. That is a bigger difference that we have. Because your massage therapies, your chiropractor, your doctor, your osteopath, your physiotherapy, they won't care about your sleeping. If you're sleeping not good, they don't care about it. If you get diarrhea, they don't care about it because they don't think this is linked to your back pain. But we do. So when you treat them, we treat the insomnia as well as your diarrhea. Insomnia is your heart. It indicates your heart does not function properly. It indicates that when your heart does not function properly, then your blood circulation is weak. So we need to bring your heart circulation better by tonify your heart. Okay. Then when you have better blood circulation, then the pain subsides. Simple as. Nothing heals without blood circulation. I talk with this again and again. I have patients who just had a heart surgery, do the bypass. Bypass, I think it was 8 years ago, and now the joint of the bypass built up some plaque, and she went and cleared up, and then she came back and said, "Funny, when I lay on the theater, on the table, it was so painful, and after the surgery, pain gone, and never came back. It's been for 2 months now." I said, "Why is that?" And she told all the surgeon and the GP, and no one cared about this. Because she was suffering from pain every day, every morning. Hardly get up. And we do acupuncture, it got much better. And because we were locked down, and when she locked down, and then the pain got worse again. That's because when they clear the plaque out of the artery, the blood circulation got better, and the pain just disappeared. And she got her daughter, did a lot of research because the doctor didn't care, and they need to know what's happening. And they ended up with her and her daughter ended up with, oh, okay, is our heart function better, the blood circulation better, then got rid of the pain in the hips. I said, well, this is Chinese medicine theory. We've been using it for 1,000 years. Right? So I want to share with you a lot of real cases in our clinic that has been telling us the blood circulation are important. Can you post the format of the question here for asking the patients, please? Thank you. Yeah. I'll share with you. Or you can go to our website on our homepage. Everyone can download from our homepage. You can get it from our homepage if you wanted to. I'll give to you. In our homepage, there is a green. Here's our homepage, our website. On our homepage, there's a green called Free Initial Pre-Exam question names. Oh, hang on, is it a good time for you to do that? Let me see. Yeah, you can directly do that and go through it. Or I asked my manager actually go to, no, I think I told her to put the form up. She hasn't done that. Yeah. Okay, I'll. No worry. This is our homepage, but I'll get her to put it on homepage so everyone can download from there. And this is a digital one, and it's no point for you to get a digital one because you're gonna fill in and become one of our patients, so you don't need to. I'll get her to put the PDF or on a Word file on our page so everyone can download from our homepage. Okay, no problem. All right. So lifting heavy is one of the things that's commonly cause of the lower back pain. Um, Over activities. What is over activities? Go for sport, running, you know, and people get sit up a lot, bodybuilder, try to build up body and try to do some certain exercise and you overuse it, you know, or what else? A lot of work can be builder, you know, um, a lot of different things like some patients get out of the car, just get out of the car, stop the car, get out of the car, and got pain in the lower back. It's important that you ask all those questions. You think about a normal person just with getting up from a seat, getting up from bed, and they got back pain straight away. Why is that? Those people always have organ function issue before they hurt their back. That's one thing. So you need to understand that, right? So if you're patient, if you come to us, we're gonna ask all those questions, right? Structural problem. Now, structural problem. See, the more commonly structured problem is you heard a lot. Is bulging disc, herniated disc, the disc causing a lot of problem. What are the discs doing? Okay, the disc is trying to separate both bone. So on the joint, you need to keep if you want to move properly, you want to keep a certain space in between so you can move, right? So you can move. If you tuck together, you can't move, and you're gonna compress together. There's no movement. So you want to move. The joint is helping you moving freely, and in the joint and between the bone, that both bone joint together become a joint, right? And this joint, it has a tissues called like a cushion. It called disc, and this disc is important. If it rupture, it can happen with rupture. It can happen with bulge and or hernia. And when that happened, the tissue inside came out, you know, and it compressed in the nerve. It can compress one side or the other side, or it compress in the middle of both sides. If it happened in the back of the middle, which you can't see it, it compresses both sides. We call compressing the nerve root. So it causes back pain. It causes tingling numbness down to your legs and becomes sciatic pain. Sciatic pain symptom, okay, it causes for many reasons. Right? It can cause from hernia disc or bulging disc, okay, or rupture in the disc. So the symptom for sciatica, it can be pain, tingling, numbness in your back as well as your lower back. And no, sorry, as well as your legs. What am I saying? Okay, legs. Okay, it can come down to your toes or just to your knee. That's it. Okay. So what causing this? Again, all this structure problem, you will find the underlying problem is the organs out of balance first. Then when they do the organs out of balance first. When they lift a heavy thing, or they get out of the car, and they get a rupture, hernia this. Okay. Hi, Kariam, how are you? From Scotland. Thank you for joining us. Arthritis. So, the arthritis can cause and happen in your joint, right? Can happen in the joint. Spinal osteoarthritis is a wear and tear issues. It's degenerative issues. Okay. Um, so it causes lower back pain too. It can be it's a cartilage issue, right? We talked about that last time. The last topic was arthritis. So over the time, the condition can lead to narrowing of the spine column, or spinal stenosis. Okay, so one of the big causes of lower back pain is commonly causes is arthritis, and we have to go back to arthritis, how we prevent it, right? We talk about it. It's diet, emotional, all this thing important. When you get hurt in the first place, you don't want to end up with osteoarthritis. You treat it properly, even if it just has some tightness, stiffness. You want to get rid of it. Why is it? Because tightness and stiffness still indicate that the blood circulation is not transferred to that area completely, fully. So you want to get rid of all the tightness and stiffness. Right? You want to prevent it to developing to arthritis. And the bone spur, it can happen in the vertebrae as well. Okay. Then the others common cause is osteoporosis. Osteoporosis is loss of your bone density and of the bone, thinning of the bone, called osteoporosis. So it can lead to a small fracture in your vertebrae. So that is important too. The osteoporosis means that you have very weak bone. Not enough calcium. Right? So this fracture can cause severe pain and can refer to as compression fracture. So this is a fracture, okay. We still can treat it. How do we treat it? They have to go for surgery first. They have to go to Western doctor first, for sure. Okay, this is something that out of our main treatment for acupuncturists, but we can do treatment afterward, after the surgery. After the surgery, we can provide herbs, Chinese herbs. We can do acupuncture for recovery. Okay, then think about it. You are eating that way, I'm eating this way. If we eat together, why just you suffer from osteoporosis, not the others? Why are you lacking of your calcium? That's not because, most of the cases, not because you haven't got enough calcium in your meal. You hear me, okay? It's not the quantity that intake of the calcium. It's because you have a stomach and spleen function problem. You have a digestive problem that you couldn't absorb the calcium. You couldn't absorb the calcium. And that's important to know. That's an organs problem. There's an organs problem, organs functioning problem. So this is a good chance to see acupuncturists and Chinese medicine herbalists, because we can help you bring the organs function better. So therefore, you can absorb calcium better. Okay, calcium better. Now, people thought that drinking milk, a milk a day, is the best intake of calcium. That is wrong. So more fracture happen in America because they have a diet of dairy, milk every day, and much less of osteoporosis that causing fracture in the poor country. Why is that? Because they didn't have money to buy milk daily. Therefore, the bonds are actually stronger than the Western people, the Western world people. Okay, the rich people. The rich people in a wrong diet. So making the bond weaker. Okay, there are research about that. I didn't make it up. So you need to think about this. Okay. All right. So what are the main causes of back pain? Muscle strain, the structural problem, the disc problem, arthritis, osteoporosis. So osteoporosis, arthritis, and muscle problem and hernia disc, all related to the organs. Okay, and of course, this all pain, you may have arthritis, osteoporosis, uh, all this problem, but you don't have pain in there, especially in arthritis. It comes to a trigger. The trigger normally is overusing it, lifting heavy. So in our life, we have to lift things. You know, you can't prevent lifting things, but what is the proper way to lift heavy things, heavy objects? And you have to learn this. When it comes to treatment, we will talk about it. How do we actually lift heavy objects? Okay, this we can prevent it. Okay, and what can we do? And we're gonna talk about when it comes to treatments. Okay, as when it comes to prevention, and we're gonna talk about all of this. Okay, now other causes of back pain, you know, so not as common, but they are causing back pain as well. So one is bacterial infection of the spine. Of the spine. There's bacterial infection of the spine. Right? Cancer, tumor in the spine. The tumor in the spine is causing back pain, cancer, bone cancer, and kidney infection, kidney stone, and what else? Apart from kidney infection, kidney stones, gallstone. The gallstone pain normally on your right side of your back, over here. Now it's not really the lower back, but it can affect the lower back more in the lower thoracics in here, and people still call it lower back pain. As I say, the pain will be over here on those two lower thoracics, but people still call it lower back pain because it's so close to the lower back, you know. So yeah, it can be liver liver function issues, liver problem, or gallstone. It can be pancreas issues. I just have a friend recently have a infection in the pancreas, and the main symptom is lower back pain, suddenly lower back pain. If it was kidney, and his blood sugar was very high. He's still in the hospital. It's a friend's kid, not very good diet. The young people, 27 years old, he thought he was all good, so not looking after himself, so get an infection in the pancreas. So this is important. Pancreas problem can cause lower back pain too, right? So all the organs can, but majority people suffer from back pain is mainly for the muscles issues. Okay. All right. That's it for today. Joe, hi Joe, how are you? Hi Eric, hi Alison. Joe from UK. No problem. Happy to share. Thank you for being here. So all of you, if you just joined us and we actually finished the topic today, you can replay it. When you replay it, you can go to YouTube or on the Facebook, you can replay it and you can fast forward to look at what I'm talking about today. What I was talking about today. Okay, that's it for today. We can see you tomorrow, and tomorrow, if everything's good, then we're gonna talk about what? We're gonna talk about the treatment. Treatment. I think we're gonna talk about treatment. So when we come to, we talk about diagnosis first. Sorry, we talk about diagnosis. Tomorrow we talk about diagnosis, how to diagnose back pain. Then further on, then we're gonna talk about treatments. When we talk about treatments, we're gonna talk about medications and maybe surgery. I want to talk about more about surgery, or just tell you about what conditions that may need surgery. Okay, and then we're gonna talk about acupuncture, and I'm gonna give you. This is more for practitioner because we have practitioner follow us in our live video. I want to show you what acupuncture point, what strategy of acupuncture point that you can follow, you can use for lower back pain. And we talk about more commonly lower back pain. So those points that you use it for every of the lower back pain's meridians. Okay. Then we're gonna follow on another day. We're gonna talk about back pain home remedies. What can you do at home? So what sort of exercise? Then we're gonna talk about prevention. How do you prevent lower back pain? So all those are important. Okay. That's it for today, and I'm Szenan from Center of Balance. If you want to learn acupuncture, if you want to know about disease, how from the start to the treatment, you want to get some information, some knowledge, please follow me. I will present the all this knowledge to you, and hopefully you do get benefit from here and get some information and gain some knowledge. Okay, thank you, and thank you Eric, and thank you Veronica for your support every day in here, watching and being with me, support me. Thank you very much. Okay, I'll see you tomorrow. See you, bye bye.